Hi, I'm Dr. Robert Brooks, and I've been taking care of spines for about 42 years. And what I want to do is I want to tell you about how we take care of the spine here that may be a little bit different than what you may find in other offices that would be offering spinal care. Sometime during the course of life, there will be an injury that tears loose ligaments and tendons that hold the bones of the spine together. And those 24 little bones that have been held together then create a weakness that allows it to break down and lock into a stress position. When it's like this, lying down, one of the legs is longer and one is shorter. Standing up, one of the hips is higher and one's lower. The body frame then has a twist or a distortion in it. Muscles are imbalanced, movement is abnormal, and then it actually progressively wears and tears and breaks down the structures over time. Once the spine's misaligned, it creates problems with the structure of the body where it's giving way. It creates problems with the nerves that make everything work, and then that, of course, in turn affects some of the functions. So we can have pain in the body, we can have functions that are not functioning correctly, like digestion, respiration, or breathing. And the nerves that come out of the spine have very specific distributions. There are 3 nerves out of the lower back down into the legs. There's one that comes across the hip through the thigh, knee, shin, and middle toes. There's another one that comes into the cheek, down the back of the leg, into the calf, heel, and outside toes. There's a third one that comes belt line into the groin, down the inside of the leg, to the big toe in the first 2. There are many people that will have pain somewhere in the legs, like cramps, knee issues, sometimes foot or ankle issues, as a result of that spine being misaligned and the distortion on the structure, or even the effect on the nerves going down the legs. There are nerves that go into the body cavity and regulate all the functions. There are nerves to the heart that create irregular heartbeats, into the lungs that actually create shortness of breath and tightness in the chest, sometimes related to asthma or even some of the other lung degenerative conditions. There are nerves that go into all the digestive system, the liver, gallbladder, stomach, and intestines. These nerves can create all kinds of changes in terms of how food digests and how it's eliminated. There are nerves that go into the energy systems, the adrenal, spleen, and pancreas. They create chemistry that gives us vitality or energy. That vitality can actually be diminished by spinal misalignments. There are nerves into the urinary tract, into the kidneys, that can create sometimes the weaknesses for urinary tract infections or even set the stage for kidney stones. There are nerves also that can go into the reproductive systems that create different sets of symptoms for men and for women. There are 3 nerves out of the neck into the arms. The first one's shoulder, down the outside to these 3 fingers. The next one's down the middle of these 2. And there's a third one under the shoulder blade through the elbow into the last 3. These nerves can then create pain going down the arms. They can create problems in the hands and wrists, as well as movement in the shoulders and elbows. And there are nerves just above that that go to the muscles of the neck from here to here that allow people to carry a lot of tension or stress in that neck and the upper part of the shoulders. There are 3 nerves that come from the brain down into the neck and back up to the head. There's one that's muscles of the scalp, inner and middle ear. There's a second one that's sinuses and eyes. And there's a third one that's teeth, gums, and jaw. So the nerves then, when a spine's misaligned, can be affecting your balance, your equilibrium. They can create vertigo. They can actually create headaches. They can create sinus and allergy issues, TMJ or clicking in the jaws, sensitivity in the teeth, and they can even affect vision, smell, sight, or hearing.